What are the different methods of birth control? You want to control birth. Different methods of birth control.
All right, thank you. There are so many methods available now. So I'd like to start with women breastfeeding. I'll take it from there. Because I said that if you are planning to get pregnant and you have issues, mostly it's the prolactin, the hormone responsible for breastfeeding, that is preventing the pregnancy. The same way, if you've had a child and you are breastfeeding, it also serves as a family planning or a birth control method for you. That's what we call the lactational amenorrhea method. That's the breastfeeding. Yes, your baby should be less than 6 months or up to 6 months, and then you should be sure that you've not resumed menstruation. So, and you are still breastfeeding exclusively. So if you are breastfeeding exclusively, you've not resumed menstruation, your baby is less than or equal to 6 months, you have a birth control there from the breastfeeding you are doing. So it's a method for the women who have conceived. So maybe sometimes from 2 months going, mostly 6 weeks, the men want to come back to us after childbirth because of the way we dress around near them, and you can't stop them. How are you going to control birth so that your 2 months child, you don't get pregnant the next month? Breastfeed exclusively. Exclusive means that you are not adding water, you are not giving the formula, you are only giving breast milk, and then you've not resumed menstruation. Because if you are doing exclusive breast milk, you hardly resume menstruation. It takes time, and then your baby is up to 6 months. It's good to go. It's a form of birth control for you.
Okay.
And then the other method I want to talk about is the fertility awareness method. That's a natural method. That's the calendar method of family planning. With this, all you need to do is to track your ovulation period, and then you name it unsafe. Those periods, now at first you wanted a child, so those periods you treat it like the king and queen, but now you don't want a child, so it becomes a danger zone. So those periods are unsafe. You don't go near. I'm not saying go and fight, but don't create the atmosphere for it. So when you know your ovulation period, so the days around 4 days around the ovulation period, don't go around sex because you may get pregnant. So that's the tracking. You are tracking ovulation, and then you are using, you are fertile. You know when you are fertile, you know when you are not fertile. That's what we call the fertility awareness. Then there are other methods I'll put together. We have the short lasting method. The simple ones like the condoms. Condoms, we have female condom, we have male condom. And with the condoms, it's the only birth control method that also protects against HIV and then sexually transmitted infections like gonorrhea, syphilis, and all that. And then so with the condoms, normally when the sex is vigorous, it may burst. You see, so they don't want toffee rubber, so they don't want to go by the condoms. They are not comfortable with it. And then the female condoms are not kind of comfortable to insert. It's the male condoms that are easy to go, but the men also don't want it. Yes, so those are the little disadvantage with the condoms. Other than that, is the best. When the sex is kind of calm and joyous, you are good to go. And then when you are removing it, you should be careful so that some of the sperm don't pour in the vagina, because condom sperm, when they enter the vagina, they enter with speed. This one is going straight. So you just have to be careful you don't pour or spill some in the vagina, because they know you're trapping them. Yes. So basically the advantages, yes, it protects against it's good for the pregnancy. Like I said, it won't make you pregnant. It protects against STIs, HIV, and then the only disadvantage is the men are not comfortable with it, and then it may burst. So that's with the
Okay.
condoms. We have others like cap. We have what we call vagina cap. There are vagina rings, there are patches and all that. But those ones, let me say, people don't even go in for it nowadays. They prefer the long lasting ones like the implant and then the IUCD. IUCD, people used to call it IUD, but it was contradicting with one of our terms, intrauterine death and then intrauterine device. So we added the C to it, making it intrauterine contraceptive device. So that when you mention IUCD, we know you are going for birth control. And then when you mention IUD, you leave that for the labor ward midwives.
Okay.
Yeah, so with the IUCD, it's the longest. You can have it for like 10 years. And then it's a copper. So the disadvantage is if you react to copper, you can't go in for it because it's made of copper. It's a T shape. So it's inserted in your vagina. It blocks the tube. And then when the sperm is coming, it traps it, makes it and then basically kills it. So that is that. You can use it for 10 years. Very cheap. It's available and affordable. There was one that you could use for 5 years, but we're not having it in Ghana now. So mostly the 10 years is available. And then we have the hormonal ones that you can have for 5 years. Implants. We normally insert it in your arm. Before you go in for any birth control, we normally interview you small. We take some history from you, knowing that you don't have certain conditions.
Yes, I was going to go on. I was going to ask you that one. That's the family history in choosing.
Family history is very important. Family history. I mentioned copper. So family history, if you don't react to copper, but the family in a way, a close family react to copper, you may have to be cautious with the IUCD. The same way, you may not have issues with blood pressure, but if there is family history of blood pressure, there is family history of varicose veins, then we'll also advise you on the implants. We advise you on the hormonals. They come in to raise levels of hormones that can fight the hormones that will make you pregnant. But they make you eat. The hormones, they like food. You know why? When you are growing up from the teens, 13, 14 going, the hormones that come to play, that comes to make you a woman, that gives you your shape. Bats are bats. Nofo are nofo. And all that nentu are nentu. Those hormones, no. Some of the family planning methods have them. Meanwhile, when you're in that, and then you've added on another hormone, which is kind of a growth hormone. So when you add it to what you already have, then it's going to increase your growth. People go fat. Or say family planning, say yes, people grow fat. When you have some fatness in the family, you need to check.
So that is the effect of the birth control.
Yes.
Some grow fat. Okay, so
some grow fat because you eat a lot. It makes you eat a lot, and if you eat a lot, then you go fat. So when you go fat people have their associating issues like BP and diabetes. So that is what it may bring to you, but it's not common. Mostly you don't see people.
Somebody is asking, what is the side effect of IUCD?
Very good. So the side effect is infections. We have an infection, we call it pelvic inflammatory disease. When you insert the IUCD, they leave 2 strings hanging. Every month you
Well, we're still connecting the network, but hey, she said a lot. She's talked about birth control, how to control birth. She was talking about the fact that you need to if you want to control breast during birth and you want to control it, yes. And he was talking about fertility awareness plan. That is where you take notes of what is going on. You take notes when you are safe, your safe and unsafe periods. You take that as your king and queen, like that's what she said. Those unsafe period, the first you wanted them, so it was safe period for it was safe period for you to have a child, but now it becomes unsafe because you are controlling birth. And vagina cap, that's when she was talking about the IUCD, and she was talking about the fact that the IUCD, the side effect of it is that infections, it causes infections and all that. She talked about hormonal ones as well. That is when you inject yourself. So we were asking about the fact that if your family history, you have BP, you have other things that can cause, that has happened before in your family, can it be a part of when you are choosing a family planning? You need to look at, and she said yes, you need to look at that, because if it has happened in your family before, it means that when you do it, it's going to happen to you. That is your BP, that is eating. And she was saying that the fact that the hormone that makes you go when you're at the teen ages are the same hormones when you start controlling the hormones, it makes you eat, so it makes you go fat and all that. So please, let's keep our question coming. I will add her again soon, but we'll be wrapping up very soon. So let's keep our questions coming. I believe that we have learned a lot of rapport that we can work around with it. We've learned a lot that we can work around it. We are still trying to connect her back. So when we do, but you can still send in your questions. Somebody is asking that the question, somebody is asking, how do you deal with breast milk issues? What could be wrong if your cycle is not stable at all? Okay, when she gets on, we are going to ask her, but hey, keep your question coming, and then I'm going to try add her very soon. She's online. I believe you are really being educated and enjoying the chat. Hello.
Hello.
Yes, Auntie Gladys. So let's go.
Yeah.
You're welcome back. We are sorry for your
Thank
network,
you.
but we are
Sorry
on.
for the
So
network.
yeah,
Forgive
yeah.
me.
All right. So someone is
All right.
asking, how do you deal with breast milk issues?
Breast milk issues. All
Yes.
right.
If
So to complete with what I was saying, I wanted to be clear if she's had the
okay.
answer to what I was saying, that the side effects is, it's not really a side effect, but in case you don't check well that you react to copper and you go in for it, then you start showing your reactions. But then, other than that, the side effect, you bring it upon yourself by not keeping yourself neat, clean. Because every month as you menstruate, you see there's two strings hanging. You push it back after the menses, and then you wash there very well. You don't douche. All you need to do is just wash with lukewarm water. Once a while, you can decide to wash down with lukewarm water with the bigger than salt in it. Just wash down, then that's it. But if you disturb yourself with trying to put things there to make the place tight and all that, that's where you cause an infection for yourself from the IUCD.
okay.
Yeah, that is it.
Okay. So there's
And then
another
with
question. Okay, please go on.
okay, so I was going to tackle the next question about the breast milk issues.
Okay.
Yes, you
Okay.
should be sure you have breast milk issues. How are you sure you have breast milk issues? You need to do a lab. There's a range to the prolactin level. Even the lab results will even tell you the normal range. So if you are below it, you will know. If you're highly above it, that's where you are going to have issues with pregnancy. That
Okay.
you need to see your doctor with the lab results, and then the prescriptions continue, because the prescriptions to this are in order. You start from a first dose, and then 2 weeks later you come back to repeat the lab, and then the next dose may or may not continue. Yes, but with prescriptions, I don't give. I don't even want to start because it's a process. Once I start, then it means I should finish, and it's a very
Yeah.
long process. So yeah.
Okay. All right. So how do you calculate your ovulation beyond 30 days?
Beyond 30 days, you are sure it's 30 days. So at the very first day you see blood, now you are not 28 days. So you don't have anything to do with 14 days. So you count the very first day you see blood to the 10th day. Okay, so the 10th day, you pick the 10th day, 11th, 13, 12, 13, 14, and then up to like 15, 16, 17, 18. So the 10th to 8, because you're not sure which of the day, so you are just tracking. So from the 10th, then you miss 11th. I said that if you are going in for a child, you should be sexually active, and you are going to have.
All right. Next week we will still continue while she's trying to work it out. So basically, she was telling us how to calculate the 30 day, the questions that you asked. Yes. You're back.
All
All
right.
right.
Yes. So the 10th, you skip 11th, and then the 12th action, 13th, you skip 14th action. This very one you don't know, so you're just tracking every other day. Yes, sometimes you may get tired. So you can even do a 3-day apart. Sperms take 3 days before they die. So with the 3 days apart, you can still catch it. So the 10th to the 18th day, so to some of them, the 10th to the 19th day, we advise that they should be on the watch out because those days are their fertile days. So if you want a child, that's where you should be active. If you don't want that,
Okay.
that don't become your danger zone.
Okay. So there's another question for you. What could be wrong if your cycle is not stable at all?
Thank you very much. Unstable cycle is another cause of infertility in women. It may be some medications you've had before. Some of them is natural. You can't really do anything about it. So you report to your doctor and we'll track because the cycles that are unstable, there's a way to track it with you that you yourself you've not even studied it. So you see your doctor with the unstable ones you are talking about. It may be stable for us. So you come with the unstable ones and then we pick the ones that we think can be stable for you. And then we work with you on that area. But some are natural, some are due to medications you've taken, some women treatment for cancer, most of them have uterine fibroids. So some of the menses that are coming is not menstruation, they are bleeding from the fibroids. So they are not really cycle. They are bleeding from the fibroid. It's not a menstrual cycle. Yes, that's why I said when you come, we will pick the menstrual cycle. And then sometimes if you need surgery to take off the fibroid, then you would have to take it off. Then we'll know which one is the menstrual cycle. And then we can pick out your ovulation.
Okay. Okay. So how reversible is birth control method? How do you, if you want to reverse it and conceive, how reversible is it easy
Okay, so I
to?
didn't finish. Let me quickly go to the others. The implants that I was talking about, there are pills to that, there are injections to that. They are all hormonal.
Okay.
Okay, so any of all the
No.
birth control methods, once you decide that I want to have a child or I don't want to continue, you just stop. If you're on pills, you stop taking it. If you're on injectable, the next shot, don't go. If you're on IUCD, go to the doctor in the consulting room. In about 5 minutes, it will be taken off. If you're on implants, same way, 2 to 5 minutes, it will be taken off. Once it's taken off, whatever happens, the next dose will not happen. And research is saying that with injectables, mostly when you stop, you see, when you stop and you want to conceive, sometimes it takes time. It takes like 3 months before you can get pregnant. But rather when you miss a shot, you may even have twins. Can't really tell, but that's from research. Yeah, so anytime you want to have a child, you can stop. I decide today I want to have a child. Tomorrow I take off whatever I am on and you become fertile again.
Okay. Okay.
So if it's
So how
condom,
costly is
stop
birth?
using condom.
Okay. How costly is birth control?
Thank
How
you. They are very
costly?
cheap.
Okay.
Very cheap. Some are even over the counter. You can just go and buy condom. You buy. You can just go. Some of them you need a prescriber to prescribe for you. So you go for the prescription and you buy. With the pills, they are very cheap. And IUCD insertion at the government hospitals are very cheap. I think it's less than 50 cedis. Very cheap. And then they are also
Okay.
available and they are not painful.
Please, where are
So
they available? Can you give us places so that we can come there if somebody needs it? Where are they
all right,
available?
depending on where you are. But where I am, I'm staying at Saperman. Amasaman has it. Amasaman Government Hospital. St. John's Hospital is a private hospital they have. Then Trust Clinic also have it at Dome. To circle any St. John's Hospital, there are so many, they all have it.
Okay.
In some
They all
government
have it.
hospital, they have it. Mostly the government hospitals
Okay.
have. And they do
Okay.
it so well. Yeah.
Okay, somebody
So
is
it's
asking
available.
that. Okay, so the withdrawal method, you didn't talk about it, but somebody was talking
Okay.
about the fact that the coitus interruptus, that means withdrawal.
That's it.
And
Yes.
they were saying, somebody's also asking that I heard the pills, when you take it in excess, it causes infertility. Is that true?
Thank you.
And
How
somebody too says
SS?
that, please, is it safe to do family planning, any of them, if you haven't even done it before? So please tackle it one after the other for us.
All right. So let me take the first question. SS pills, if I get it right.
Yeah. Yes.
It means
Causes
that she's been
infertility.
on it for a very long time.
Time.
And the reason for being on it is not to get pregnant. So when you
Okay.
are on it for a very long time, the system gets used to it. So coming back to get pregnant will also take time. But it
Okay.
doesn't make you infertile. It will take time for you to get pregnant. Because if you've been on it for a very long time. And that's like if you've been on it for like let's say over 5 years or let's say 10 years. That's where you are going to get this long term kind of not infertility but not being able to get pregnant because you've used it for a long time. So we
Okay.
advise that when you are nearing 35 years and you are sure you will have a child again, don't be on it for long because now some women start menopause at 35. So if you still want to have a child again, then you need to stop it, have your child, and then 35 years going you can continue with that. If you don't resume, you are off to menopause. So you
Okay.
also need to consider the age. If you are 40
Okay.
years and you have pills, then know that you may enter menopause with it. Because maybe naturally your menopause even started at 35. So it's not the pills that is making you not give birth, that you've entered menopause. Sorry. That you've
Don't worry.
entered menopause. Yeah.
Okay.
Yeah, so
So
that's cool.
so the next question was okay, somebody's asking what is the difference between cyst and fibroid?
Cyst and fibroid. Okay, thank you.
Yes.
So cyst happens in the
And can the cyst hinder conceiving?
yes,
What's the
please. Okay.
difference
So
and whether it can
okay.
yeah.
So the cyst is a collection of fluid with infection, and depending on where it is, it's hinder pregnancy. When
Okay.
it's an ovarian cyst, the area where the egg may be producing and expelling may be where the collection of fluid is going on, where the cyst is.
Okay.
So with that, you can hardly get pregnant unless you get that cyst off. If it's in the
Okay.
tubes, you may get pregnant, but as the pregnancy is descending to the uterus, it meets this cyst and it's not able to move again. You have an ectopic pregnancy and it ruptures. Or the sperm and the egg will both die in the tubes and it will just wash away. And then
Okay.
normally we also have, that's the ovarian cyst, and then we also have the tube. You have the mouth of the cervix. That's where you have the cervical cyst. Sometimes it hides there at the tip of the cervix. Sometimes it's in the vagina, but mostly at the tip of the cervix. It blocks the entry of the sperm. So mostly you are not easily to get pregnant. So you need to clear the cyst off.
All right.
But
So
fibroids take place in the uterus, in the womb. It's an abnormal swelling in the womb.
Okay.
Yes.
All right. So
And
somebody's also asking, please, is it safe to do family planning if you haven't given birth before? All right. So the network, our guest has been so wonderful and very educative. I don't know about you, but I've really learned a lot. The things that I didn't even know, I'm learning it from this live chat. Hello, welcome back. And please, the question is, please, is it safe to do family planning? Are you there? If you haven't given birth before. All right. So whilst we try to connect to, all right, is it safe to do family planning if you haven't given birth before?
okay.
All right. So the network is not too stable, but when she joins us, she's going to answer that question. And I think we've exhausted all the questions. She's been able to. Hello. We have few minutes remaining. So please, can you answer that quickly for us so that, yes.
Please, can I get it again? Can I get the question again?
Is it good to do family planning if you've not given birth? Followers, thank you for joining us live chat with Wingo Family International. It's been a very educative one, and we are very sorry, but we really enjoy this chat. And I mean, we've been educated, things that we didn't even know, we've learned it. Our guest has done very well. If you want to ask more questions, please follow our guest Gladys Desewu on Instagram. She's work with the SNET Hospital, so you can follow her and ask more questions. I can send the numbers to you when you send me private messages. I can send her number to you so that you can call her. But thank you very much for staying in with us. We really enjoyed you. We hope you've learned a lot, and then you're going to practice what we have learned today. And that's the next time I'll hear is that you're pregnant. The next time I'm here is that you've been able to control birth. The next time I'm here, we are happy and we are all enjoying our family. Thank you very much. Enjoy your evening. Have a good one. And remember to fire everywhere. I mean, anywhere, kitchen, the bathroom, everywhere. If you are ready and readily to conceive, then keep on firing. And then your ovulation date, do not miss the 13, 14, 12, 13, 14. That is when you need to fire more. So continue the firing and you'll be fine. Bye.